Hello everybody, it's Mariana from Mech Physio. What I want to start talking about is common problems experienced by new moms. Since I am a mommy to an adorable 3-month-old and I'm a physio, I have some fresh insight on certain problems that moms have with different parts of their body. A lot of focus is on pelvic floor for sure, because, obviously, but I wanted to talk about low back problems, lots of low back pain for new moms for sure. And the two pieces of furniture that I wanted to highlight that are often the cause of the low back pain are the bassinet and the crib. Both pieces of furniture, the little mattress is quite low, even for some below hip height. And what happens is two things. The first one is your neck cranes forward into a really bad forward head posture every single time you are laying your baby down in the bassinet or crib, and every single time you are going to scoop them up into your arms. The second thing that happens with these two pieces of furniture is that you have to do a deep lower back bend as well. So it's a lot of strain on your intervertebral discs and a lot of strain on all those tiny little ligaments that hold your spine. So what can we do about these things? The first one is just having more awareness that you're actually doing this. So by virtue of you guys watching this video, you've already helped yourself because you've created awareness that your body is in these positions whenever you are at your baby's, whenever you're caring for your baby. So then the next step is to start to modify some of the positions and behaviors you do with these two pieces of furniture whenever you're handling your baby. The first one, so we're going to talk about bassinet. So anytime you go to put your baby down into your bassinet or take the baby out, I want you to think of weightlifting in the gym. You guys all remember the gym, right? Bend your hips, bend your knees, do a full-on squat whenever you're putting baby in and out of bassinet. The second tip that I have, and this is more for cribs, because as you know, the crib, it has a high, you have to bend over in order to access your little one. So the first tip I would recommend for this, because there's absolutely no way around bending over the crib, the first tip I would recommend is to start stretching out your hamstrings. The hamstring, just a quick review, is a big muscle at the back of your thigh that connects from your ischial tuberosity, which is your sit bone, all the way down just past your knee. Okay, so why do you want to stretch these? And how is that going to protect your back for bending over the crib? You want to stretch them because when you do bend forward, you want to have the hamstring muscle elongate or stretch instead of your lower back segments bending. Does that make sense? So instead you're stretching a muscle, which muscles stretch and contract all day long without any problem. You would rather stretch the muscle to bend forward than to put most of the load on the lower back. Okay, so just to recap, when you're at the bassinet, you're gonna squat. When you're at the crib, you're gonna bend forward, thinking of stretching the back of your leg and having a less bending of your lower back. Okay, like really try and visualize this in your head, because it'll make it a lot easier for you to actually feel that this is happening. And it'll be a positive feedback. You'll become way more aware, and then pretty soon it will be a habit that's just how you move your body when you're lifting your baby out of the crib and when you're putting them in. Stay tuned for some more videos about common problems experienced by new moms and some solutions that I would highly recommend.